Okay, let me just
Hi,
turn that
everybody. I'm
off.
here with Meryl Dorey. Hello, Meryl. How are you?
I'm good, Russell. How are you?
Great. It's cool down here, but it's very hot where you are. Is that right?
It sure is. Yep. Yep.
Hi.
And humid.
Meryl, briefly, tell me about yourself and your story.
Well, I was just about the most pro-vaccine person you'd ever want to meet before I had my children. I never questioned whether vaccines could be safe or effective or cause harms. I just believed what I was told, as most parents did then and probably still do. And it wasn't until my firstborn child, my son, had his vaccines and had a serious reaction to the first lot, that I started asking questions. But I kept vaccinating because I thought it was just the thing that you did. And then when he was 18 months old, he had his measles, mumps, rubella vaccine and was hospitalized for 10 days after that. And that really got me interested in trying to find information, more than I did before. And it was not easy back then. This is 1989. We didn't have the internet. We didn't have much in the libraries, but I did as much research as I possibly could. And over a period of years, and looking into these issues and trying to treat my son's problems from the vaccines, and speaking with so many other parents who also had children who'd reacted, I formed an organization in 1994 called the Australian Vaccination Network, that is now the Australian Vaccination Risks Network. And in that time, I've spoken with many thousands of families whose children or loved ones, because it happens to adults too, um, either were killed by vaccines or had serious reactions with lifelong ill effects. And that has sort of been my journey. And I don't consider myself anti vaccine even today, except under the new definition of anti vaccine, which came in just before COVID, which said that if you do not believe that all vaccines should be mandatory for use by all people, then you are anti vaccine. It's not my definition, that's the new definition. And according to that, I am anti vaccine because I don't believe that any medical procedures should ever be mandated.
So you're not actually an anti-vaxxer, but you do suggest that vaccines are not safe or effective, but most of the medical community and most Australians particularly might say that that is not right. Why should anybody believe you or me in this case?
Well, I have always said that nobody should believe me, nobody should believe their doctor, and nobody should believe the government. It is up to each one of us to take responsibility for our children and for our own bodies. And that means doing research, speaking with people on both sides of the issue, reading the information. A lot of parents think that this is all too technical. They, as lay people, can't possibly understand the information about vaccinations. So they just say it's too hard. I'm just going to do whatever my doctor tells me. And you might be one of the lucky ones who doesn't have any ill effects from the vaccines. But if your child is affected, or if you are affected, then I think you're going to be really regretting the fact that you may not have done the necessary research to look into this issue. And it is possible for non medical people to understand this information. It's not rocket science. It's not even medical science. There is an awful lot of information out there that is easily accessible and understandable. And I think parents should definitely make themselves um, open to this details. So doctors, when doctors study vaccination, and we had the curriculum for the New South Wales uh, School of Medicine at UNSW, University of New South Wales, and it was, out of 4 years of medical school, there was one morning where vaccinations were discussed, one morning. And the discussion was not about safety, efficacy, any of that. The whole information was, these are the vaccines that we're giving out. This is how to administer them. And this is how you report that you gave someone a vaccine. That's it. And if you ask any doctor from AMPS, the Australian Medical Professional Society, or any of these other organizations, what did you know about vaccinations when you came out of medical school? They will openly tell you, we knew nothing because we learned nothing. So when we're told, ask your doctor, they're the expert on this subject, I don't believe they are. And I think that any parent who's done a modicum of research will be able to know more about this issue than the average doctor.
Um, all right. Say it's possible that a child or an adult can be permanently injured by a vaccine. If you have adverse events, even if they are remote probability, how can mandates and coercion possibly be justified?
They can't be justified. There's an expression, it's a bit of a cliche, where there's risk, there must be choice. And that goes for vaccination, it goes for any medical procedure. There are known risks, including the risk of death and lifelong disability. So when there is a risk, there must be a choice. The way that the government and the medical community justify mandating vaccines is that they say that an unvaccinated person is more likely to carry and transmit infections than an unvaccinated person. But in over 30 years of research from the medical literature, I have never once seen an article that compares that, say, takes a group of unvaccinated people and a group of vaccinated people. And sorry, my daughter's cat is trying to get in front of the camera, and
Right.
and looks at that issue. It's simply not done. But there have been studies. There was a baboon study that was done probably 15 years ago that showed that uh, people who got the DPT vaccine, diphtheria, tetanus, and whooping cough, or sorry, baboons who got the DPT vaccine were 20 times more likely to carry the whooping cough bacteria in their nose and throat than the unvaccinated baboons. And with COVID, we saw very clearly that it was the COVID jabbed who were most likely to be contracting and spreading COVID, not the unjabbed. And the increase in the risk of spreading and contracting COVID increased with the number of jabs the person got. So someone who got 2 jabs was less likely to share and contract the disease than someone who got 4 or 5. And these are the things that the government should be looking at. We should be open to looking at all science, all research, but it's as if there is a wall up. Anything that contradicts the mantra of safety and efficacy and necessity for vaccines is behind this wall and will never see the light of day. And we see that in the United States, where the Food and Drug Administration and Pfizer have been trying very hard to suppress any information from the pre-licensure trials for the COVID vaccine produced by Pfizer. They wanted to keep that shut up for more than 75 years. And about 30,000 pages were released about 18 months ago, I'm guessing on the date. And a court in the US has just said that the other 100,000 pages, which included, I forget how many, 158,000 serious reactions, must be released by June 2025. So that information has to come out. And it is not the people who question vaccination who have been suppressing the data. It is the people who have been profiting from it and the governments who have been pushing it as part of their agenda, who have been suppressing this, and the media. They played a role too. So we're calling for complete transparency and no mandates, no coercion, no financial penalty. We are all Australians. Let's unite and demand the truth. That's all we want, the truth.
Well, you've been working on this obviously since the late 80s, early 90s, um, but only recently in that time frame, 2016, um, the no jab, no pay, no play legislation came in January, and by the Scott Morrison government, which I was a part. What was the background of that, and how do you think that it got its initial genesis? That's the way you drive people to vaccinations.
Yes, well, our organization and I personally was involved in 1998 in going to Canberra to lobby for changes to legislation that would protect and defend a parent's right to make a conscientious objection to any vaccine so that they could send their children to preschool, childcare, and not lose any financial entitlements that other parents get. And we managed to get the conscientious objector clause passed into legislation in 1998 with the help of the independents, the Greens, the Democrats at that time. And until 2005, until 2015, I'm losing my dates. I'm sorry, Russell. Until 2015, parents had an absolute right to choose not to vaccinate. But during that time, around 2014, the Murdoch media started a very strong campaign called No Jab, No Play, where they were pushing government, and they have a lot of power, the media. They were pushing government to bring about laws that would prevent any unvaccinated child from attending preschool, childcare, or their parents from getting access to any government entitlements, including the family allowance. And we participated in a Senate hearing in 2015. And from memory, there were something close to 5,000 submissions sent into that hearing, and only a handful of them were in favor of the changes, but it passed anyway. And as a result of that, and Scott Morrison was a big mover and shaker in that he was very proud. He called himself Mr. No Jab, No Pay. Because of that, parents lost the right in many states to send their children to preschool or childcare, and all parents across Australia have lost access to the child care allowance. So parents either have to choose to not work or to work and spend up to $100 a day per child to get them into childcare, something that their vaccinated peers are entitled to. So as a result of this legislation, Australia was divided into two segments, the haves and the have-nots. The haves are the ones who chose to vaccinate or were coerced into vaccinating, and the have-nots were the ones who had to suffer as a result of their decision not to vaccinate their children. So we have a two-tier system of justice in this country and a two-tier society.
And that's a disgrace. Has there ever been any studies to show that vaccinated children against unvaccinated children in any area, whether it be smallpox or measles, or have they, because, you know, I'm one of those people, probably like yourself, I totally support vaccinations that are safe and effective.
Oh, you know what? The difference between our side, the side that questions vaccination, and the other side, the side that just says take your vaccines, is that I want to be proved wrong. I really do. Because the idea that generations, literally generations of children have been seriously damaged and killed as a result of these things does not sit well with me, and it shouldn't sit well with anyone. But the fact is that there has never been a vaccine that has gone through the scientific testing, the double-blind placebo-controlled study. Aaron Siri, who you may or may not have heard about in the US, he was trying to get even one study out of Anthony Fauci, who is the head of the NIAID in the US and the NIH. And he, you know, Anthony Fauci said, oh no, we've got dozens and dozens of these studies. And finally, he had to take Fauci to court. And at the end of it, it was found that no, there were no studies. So the science simply does not exist. There have been a couple of small independently run studies of children who are vaccinated versus children who are unvaccinated. And one of the most probably famous ones is Paul Thomas's study. Now, Paul Thomas is a doctor in Oregon. He lost his license to practice medicine when he published this study, even though there was no criticism that could be thrown against it that it was wrong. So he had a 10-year cohort of children in his practice. He's a pediatrician, and I don't remember how many children there were, but quite a few thousand children. And he followed these kids for 10 years. Now, in his practice, most of the children would not have gotten all vaccines according to schedule. So there were some children who got no vaccines, some children who got a few vaccines, and some children who got a few more vaccines. But I don't think there was anyone in the whole practice who got the whole infant schedule. And that's important to note because even without the fully vaccinated children being in this study, the differences between the health of the unvaccinated and the health of the partially vaccinated and the more partially vaccinated was extreme. In terms of things like allergies, asthma, eczema, autism, ADD, just the list goes on, diabetes. All of these things were virtually non-existent in the unvaccinated cohort and were much more common in the vaccinated cohort. And he even said, if we had a cohort of fully vaccinated children, I expect that they would have been even worse. And we see this in society as a whole today. When I grew up 100 years ago, um, we we didn't have these things. I met my first asthmatic when I was 26 years old. I went skiing and one of my friends pulled out a puffer and I said, "What is that?" I had no idea what it was. Now you go into any school and most of the kids have some sort of chronic problem. And in fact, according to the Australian Bureau of Statistics, and this is a good 15 years ago, more than half of Australia's children are currently being treated at that point in time for at least one chronic condition that they were taking drugs for every single day. That did not happen when I was a child. We've forgotten what healthy children are, and we need to have our government take this seriously. We have the Australian Childhood Immunization Register, which started when the conscientious objector form came in. It links all children and adults with the Medicare database. So it would be very simple to say, let's push a button and let's see, here's the unvaccinated cohort, the partially vaccinated, the fully vaccinated. What's the rate of autism? What's the rate of chronic conditions? What's the rate of asthma, eczema, all these things in all three of these cohorts? But the government has steadfastly refused to do that study. And I think they know that the study will show that vaccines are really harmful, and that's why they're not doing it.
I think you've raised policies. Now, what would you like to say to the Prime Minister if you were sitting here now?
Oh man, boy, I have a few things to say to Anthony. I think that I would love to know, first of all, what his discussion with Bill Gates was concerning before he decided that he was not going to intervene in the states when they mandated shots before the pandemic came in, because those mandates, I believe, were influenced by people like Bill Gates, Gavi, the World Economic Forum. I would like to find out what information he actually had before saying that he was going to give an emergency use authorization, which is not called that in Australia, but the emergency use authorization for the COVID jabs. Why was there an emergency? Why did he throw away all of the prior plans, the PPP, that described exactly how Australia would handle a pandemic? And none of that was done. Instead, all the things that the government before had looked at and said, this is how we're going to do it, they were thrown out the window. And instead, we had lockdowns, social distancing, masking, and mandates. None of those things were actually discussed prior. And as we've seen, I mean, hindsight's 2020, but as we've seen, um, none of it worked. And it was counterproductive. We have the government's not admitting to this, but we have thousands of deaths reported following the COVID jab and hundreds of thousands of reactions, many of them serious. Pardon me. So I'd like to sit Anthony Albanese down and say, when are you going to look at this? When are we going to get the Royal Commission? And when are you going to take responsibility for your actions that have caused all these problems?
Well, we've been here with Meryl Dorey. Meryl, thanks for being with us today. I'm sure there's other people out there who would like to tell their story too. And how my fear is that they feel that they're abandoned and they're on their own. And through people like yourself, I want to let them know they're not abandoned and they're not on their own. If they have a view about this or they want to tell their story, they might like to come back to you and I through the normal channels and tell us your story because we love to hear it. So thanks, Meryl Dorey,
Absolutely.
for being with us today. Thanks for telling us your story, and thanks for you doing it in such a simple and down to earth way. Thanks, Meryl.
Thank you, Russell.